So with the clinic closed at the moment, commonly we're getting a lot of patients calling us with acute lower back pain. We are attempting to try and screen them the best we can and work out if they do need hands-on treatment or referral. One of the things that we are doing, and this is a general test, is we're getting the person to see which way it actually hurts. So first of all, I'll get Georgia here just to tuck her chin to her chest and try and bend down and roll forward. Some patients may not be able to go this far, some might be able to go all the way down to the ground, or some may not be able to move at all. Then we get them to come back up, and then I get them, if they can, to bend backwards slightly, so, and then coming back up. And then my next question is if you had to do 10 of each of those, which one would you prefer to do? And a lot of the time people will, prefer to do one or the other. Sometimes they may not be able to do either. If they're unable to do either, then a lot of the time that's when we're sort of suggesting they potentially need to seek advice from their doctor. What I would then do is, let's say George, as an example, identify that, bending forward actually feels quite good for me at the moment. I would encourage her to apply some heat to that area and then to perform 10 forward rolls. So she'd start doing her 10 forward rolls. As she's going along, I'd get her to try and keep her hands on her thighs, just in case if they have any sort of episodes of spasm, that she can catch herself if her back is going to possibly spasm. And also too, as she's going along, I'll get her just to take note of, is it getting better? Does she feel as though she's moving her hands further down her legs? If she feels as though it's getting worse, then I want them to stop. But I normally say at least attempt sort of 5 or 6 first before you make that decision. And if you get to the 10th one and it's improving, then it means that, things are probably good and we can continue along with this method. And so what I would then say to George is have a rest. About an hour later, we'd apply some more heat, and then we would perform the exact same activity again. And this is obviously done the same way in terms of extension. So if George struggled to go forward but felt good going back into extension, we would encourage her to bend forward back into extension after obviously applying heat. Because what we want to encourage at this stage is movement, because any movement is good movement as long as it's not causing pain. Because a lot of the time at this stage, what the body is doing is going into a self-protective mode and is trying to protect all the soft tissues around the area. But if you have any further questions, feel free to give us a call at the clinic, and we're happy to help and advise.